schizophrenia? Why is it such a problem? Why is it considered such a serious mental disease? Why?
Well, it is a serious mental disease, but actually the definition of serious is actually a matter of functioning.
Okay.
Individuals with mental illness who have low functioning, that's what makes them be diagnosed with or defined or classified as serious mental illness. So it's independent of diagnosis. It's actually more the function.
Do you think part of the problem is poor diagnostics, that they don't always do a good job of diagnosing someone as schizophrenic or bipolar, or because the behaviors can be all over the place?
Absolutely. Diagnosis in psychiatry is what we observe. It's phenomenological. It is not etiological. We don't diagnose diseases, it's disorders. For that matter, someone who was diagnosed with schizoaffective disorder 10 years ago with the new criteria would have a different diagnosis.
Okay, the ground is shifting under our feet.
Which makes it hard.
I've seen that big textbook that comes out. It's the number 4, it's the number 5.
We're number 5 right now.
Number 5 right now. But let's make a distinction then between schizophrenia and other serious mental illnesses. How does schizophrenia per se differ?
Well, schizophrenia is a pervasive brain disorder. It's probably the most severe disorder that we treat in psychiatry, and it affects almost all areas of the brain. So although we think of that as primary psychotic symptoms, hallucinations, delusions, really patients don't have the insight into their illness. They often don't want treatment. They often aren't compliant with their treatment or adherent. And that's why we may diagnose them, but many of the patients don't continue in treatment.
You know, one of the things you said struck me, and I don't think we would have said this several generations ago. You said it's a brain disorder. You didn't say it's because you're a bad person. You didn't say it's something that you've acquired because of things you've done. There's something biochemical. There's something physical inside your brain.
Absolutely, and now we know that over time it's actually a degenerative brain disorder. You actually see brain tissue loss, and the level of functioning continues to deteriorate. And we know that you lose much of that functioning early in the disease course. And that's why it's critical to get these patients into treatment early and keep them into treatment.
Well, the implication of that is that if you treat them, they don't get the brain loss. But is that true?
Well, we don't know that per se, but studies looking at, for example, when you can assure patients, or better assure patients are on medicine with like long-acting injectable medicines that I think that we'll talk about, you can look before and after the start of long-acting injectable medications. And when you do what's called mirrored images studies, actually looking before and after, you can see significant improvement in maintaining stability.
So the answer is yes.
But actually, you mentioned disorders of the brain. Actually, they're systemic. It's not just the brain.
How is that?
Individuals with schizophrenia or bipolar disorder have a higher prevalence of medical conditions, higher than the general population. So for instance, diabetes, it's more frequent in individuals with schizophrenia or bipolar than in the general population. So we used to say disorders of the brain, but they're actually systemic, and it has to do with inflammation that happens in the brain, and it also in other systems of the body.
The longer I stay in medicine, the more convinced I am, this is, by the way, editorial, Salgo et al., unpublished data, inflammation is at the root of everything.
Yeah.
It's really fun to take a look at this, not fun if you've got it, but the more you look, the more inflammation raises its ugly head, and the more we're going to see that controlling that looks like it's an issue. But let's go on about schizophrenia, since I do want to focus on this a little bit. You were talking about the long-acting agents. We're going to get to them. Correctional facilities. We touched on the incidence of schizophrenia in correctional facilities. The question that comes up, I think everybody asks this question, is, are schizophrenics inherently violent? Should they be in correctional facilities in the first place? Or if they're just medically ill, if there's inflammatory issues, shouldn't they just be treated medically? Keep them out of the jails and prisons.
I think the jails should be the last people for people with mental illnesses. It should be the last resort, and we need to build a better system of care. Last year, we had about 1.5 million people in the United States arrested with serious mental illnesses in almost 2 million incidents. And on any given day, we have almost 550,000 people in jails and prisons with these serious illnesses, and another 900,000 under some type of correctional supervision. And the costs are enormous. Last year, the county spent combined over $80 billion in correctional costs. The state spent another $71 billion in prison costs, and much of this is due to untreated mental illnesses and substance use disorders, when we should be taking those dollars and building really good community mental health systems so people don't end up in our system.
All right.
And not only that, people with mental illness, especially serious mental illness, who end up in our criminal justice system, they end up more likely to be victimized. And so not only are we putting someone with a serious thought disorder in a setting where they shouldn't be, but we're setting them up to become victims. And so instead of talking about how they, may be at risk of violence, which I don't believe they are, they're more at risk of being victimized.
Well, what does victimized mean? Let's get a definition here. What do you mean by that?
So I know that there is a low frustration tolerance in correctional facilities for individuals with serious mental illness from the other inmates as well as the staff. And they are likely to become victims of fights, victims of sexual abuse, things of that nature, because they have a difficult time contending with rules as well as speaking up for themselves.
And re-traumatization while they're inside.
It's physically dangerous.
Yes, and it also is consistent out in the community. They are also much more likely to be victims of violent crimes than perpetrators of violent crimes. By far, it's not even close. And on treatment, people with serious mental illnesses are much less likely to be violent than the general population.
So that answers my first question, right? Is it the common view is, oh my gosh, these are schizophrenics, they're violent, put them in jail. Given that you know that, you're a judge, prosecutors know this, defense attorneys know this.
They don't know that.
They don't? Why
That's
not?
part of the problem. There is such a lack of education across the entire field, among the physician population, the legal profession. In fact, we just rewrote the American Bar Association standards on this, and we added a whole section that we need to start teaching judges, prosecutors, and defense attorneys on how to deal with these issues.
All right.
Stigma is so pervasive in this arena.
So is that why schizophrenics, so many of them are incarcerated? People just don't know the numbers?
I think it's not that they don't know the numbers. The appropriate treatments are not available in the community. You need sometimes a structured setting. Our laws are antiquated, they're fragmented. Getting access to care in America for people with mental illness is very difficult.
And it's also take a breath over here.
And it's difficult for law enforcement as well. So when law enforcement are called to a scene where there is someone with a serious mental illness, particularly a psychotic disorder, they can either take them to a hospital and end up spending hours of their day there, and then what's happening to the real crime that's occurring in the city, or they can take them to the jail and drop them off at a lockup facility. It's a balance of the two,
Right.
and we really need crisis centers where officers can drop people off and know that they're going to be assessed and an appropriate treatment plan will be developed.
In fact, the majority of individuals who suffer from serious mental illness and are incarcerated, it is not because they committed violence against others. It's usually either they've been victimized, or for that matter, it's minor breaking of the law.